Welcome to Shrink to Shrink, a psych view on the films with Dr. Colleen Mullen and Courtney Calkins, bringing lessons learned from the big screen into our own lives. You thought you had problems.
Well, hello and welcome to Shrink to Shrink. I'm here with Dr. Colleen Mullen. Come on in, doctor.
Hey, Courtney. Glad to be back with you. It feels like it's been a long time. I think we're out of sync this time.
We are. We're a couple days late. So
yeah.
We'll have to be nice and get it up early next time. So, but this movie made it really, really easy to pull out all the psychology because we're doing Silver Linings Playbook, and I had seen it before. Had you seen it before we had picked it?
I had seen it before, a long time ago.
I mentioned it to a couple of my movie podcasting buddies, and they're like, "Oh, you picked an easy one." It's like, well, yeah, we don't have to really work. Why should we have to pick movies about relationships that have nothing to do with crazy and build them in? Look at the psychology of it, because sometimes it's some of the obvious stuff, like in Silver Linings Playbook, that make it easier to actually talk about real things that go on with people.
Right, and you know something else about this movie. So I watched this movie a long time ago because it was such a big deal made out of it, like this wonderful, accurate portrayal of bipolar disorder, and I have a different take totally on some of the diagnostic stuff, and then you and I are going to talk about and share some scenes where things are just wrong as far as therapy goes and what happens. And so for people that don't know, they might have gone, "Oh my gosh, this is how it is," or "Is this what therapy looks like?" And hopefully we can share a bit of our understanding of psychology and help people decipher what's good for the movies is not necessarily true in real life of what goes on in the therapy process.
Yeah, I think if you just thought therapy was like it was in this movie, you wouldn't go to therapy.
Exactly. I mean, I'd be terrified to go based on the things that happen that we'll let everybody in on.
Well, okay, so our movie starts out and we've got our Bradley Cooper. What is his name? Who's our guy?
Pat.
Pat. Okay, so he's just getting out of the mental hospital. His mom is checking him out, and so here's how her conversation with him as she's checking him out of the mental hospital.
Technically, you can take him out against our recommendation, but you assume a lot of liability in the eyes of the court, and he's just getting used to the routine here.
I don't want him to get used to the routine here. 8 months is already long enough.
One of the businesses that is kind of a sister agency to ours is a long-term care for the adult mentally ill. And they were talking about some of the acute patients they get. So the short-term patients, they said a lot of what they do is they take them off coffee and they take them off their meds and then put them back slowly on the meds so that they're not taking a big cocktail. Because I think that sometimes people do get better inpatient or in facility, and then they can't bring those benefits back out once they get into real life once they get out. And so I think that's what mom was trying to do. Like, I don't want them to get used to it.
Well, and I think it also speaks to the family dynamics when you have someone who he's done a wrong thing. I mean, he was traumatized. There was a trauma that happened, and he reacted violently to the recognition of this trauma happening. And we'll go into that in a second. But often parents want their kids to be okay, and even though he's probably a 30-something kid, his mother still just wants him to be okay, says 8 months is enough. Why? I don't want him to get used to this, because she just wants him to be fine again. She wants him to be just like he was before, which, if he's first diagnosed with bipolar at this age, which is part of the premise of this, he's now got a new plan for his life, essentially, for maintaining the symptoms and kind of balancing his life out. He might not be the same as he was before, because now he has a different understanding of what goes on for him emotionally. But I think that scene speaks to, mommy just wanting to take her baby home and go, "Oh, you've done enough, you've helped him, let's get him out of here." And what they do is they actually sign on the court papers to take responsibility for him. So she's not signing him out necessarily against medical recommendations, but she is signing him out and saying we are now responsible for him rather than the hospital being responsible for him to the court.
Which is kind of ironic, because I always think about that. Well, he's going back to the same type of, I won't say crazy environment, but all of our families are crazy. They all have their ways. Mm-hmm. And he's going back into the same, dad who has all these superstitions, and the mom who, just makes pies or whatever she does. I mean, she just, you know what I mean? She doesn't address any issues. She doesn't call anybody out on, boy, that's nuts. She just is good at enabling things to keep continuing on how they're continuing on, not making any changes or getting better.
Right. And for these cycles to go on in families, like everybody plays their role. And when you say, there's dysfunction, the dad does his superstitions, like we're going to see the apple doesn't fall that far from the tree, yet Pat is the one that is like diagnosed as, quote unquote crazy. He's the one that everybody wants to take medications. He's the one that is how we would call the identified patient, right? If our client comes in or the family comes in, it's kind of like, hey, fix my son, or fix my wife, fix my husband. Like they're the problem in this family. And really everybody plays their part. Now, bipolar is physiological, disorder, certainly, but we all come from somewhere and we model behavior that we know and interactions that we know. So I think that, bringing somebody home to the same environment, that's why so much so when people are in hospital, whether it's for short term, like a couple of weeks to a month of like kind of intercepting after a crisis, or longer term or recovery work, going in for 30 days to a rehab facility, it's so important to do the family work, to participate when they call you in for family group, because the person that you love didn't get to that place on their own. There are always behaviors and environmental stimulus that support how people react to things. And it's only when you intervene on that can change.
Well, I think he probably, most likely, 99%, granted we're dealing with the character here, he had bipolar before he got diagnosed, because what drew the attention was when he acted out, right?
Yes.
So even when and we'll get to the incident that led to his trauma and him acting out, but he described, I got in a fight with the principal, and then I was going home early. It's like, well, you probably had this diagnosis, but you made it work. You functioned, and nobody could put their finger on it. They just thought, well, sometimes you have a lot of energy and you say a lot of things and you don't edit yourself and you get very motivated. Okay, well, that's not the disorder. That's just who he is.
Yes. And I think if we play the next clip, I think that's going to speak to then the anxiety that raises up in the family after signing him out and taking responsibility for him. So why don't we get right into that?
Fix it now.
Get in the car, Pat. You have to go to therapy.
I don't want to go to therapy.
You have to go. It's part of the deal. You can't live with us and not go.
So she's doing something different. She's saying you got to go to therapy because that's her deal.
Right. Well, now they're responsible for him, right? So now they have to live up to what they've signed on for. But like that, on one hand, Mama said, no, this is enough. And on the other hand, the anxiety comes up and says, oh, but now we're setting different parameters for you to live with us. Now you have to go to therapy, and they're not even in the car yet. And she's going like, you better do this. You better do this. And kind of speaking to, for as much as she's enabling I see as an anxiety-based behavior, because you just want everything to be okay. So if he just goes to therapy, everything will be okay. They'll meet the court requirements. He'll he'll be fine. Kind of thinking is what you see a lot of times, and that's what I took from that.
Yeah, and there's a lot of times, because I work with foster kids and parents and people kind of who have these serious life situations, and they get referred to therapy, and for some reason, the world looks at it like, well, are they in therapy? Yep. Okay. Well, then that's all we can do. And it's like, how much do you expect it's going to be able to happen in 1 hour a week? Because to me, the therapy is throughout the week with the people in your lives, changing all the other pieces. My goal when I work with a client is not to make him a great client. I don't want him to be great for an hour. I want him to be great all the rest of the hours.
Right.
So, I would hope that in this doctor's treatment, were he not a quack like he is, he would involve family members and just the whole milieu of his whole life before the incident happened and he started acting out. So why don't we go ahead and get to the incident because we kind of have to set the table for how did he end up coming to the attention of, I guess, not only the law but the psychiatric world and end up having to start inpatient. So this is him telling how he got there.
I have one incident.
One incident can change a lifetime.
But I'm ready. I'm ready to take responsibility for my side of the street. She just needs to take responsibility for hers.
What's hers?
What's hers?
Mm-hmm.
Are you joking? Well, let's go back to the incident. I come home from work after I left early, which I never do, by the way, but I got in a fight with Nancy, the high school principal. I come home, and what's playing but the song from my wedding? The song that you so charmingly played out here today for us. That's playing, and I don't think anything of it, which is odd, because I should have. I come home, what do I see? I walk in the door, and I see underwear and pieces of clothing and a guy's pants with his belt in it, and I walk up the stairs, and all of a sudden I see the DVD player, and on the DVD player is the CD, and it's playing the wedding song, and then I look down, and I see my wife's panties on the ground, and then I look up, and I see her naked in the shower, and I think, oh, that's kind of sweet, she's in the shower, what a perfect thing, I'm gonna find her, and maybe I'll go in there, we never fuck in the shower anymore, maybe today we will. I pull the curtain back, and there's the fucking history teacher with tenure. And you know what he says to me? You should probably go. That's what he says to me. So yeah, I snapped. I almost beat him to death. But then I get fucking chastised for it. I get that I'm parallel to my father. I don't think so.
Yeah, I'm not just like my dad.
Yeah, right. That's what he takes away from it. He goes, I almost beat him to death. And then I get chastised for it as if, everyone should just overlook that fact and go, and move on. Because it happened over a month ago now, he's over it.
Right. One incident. Right. And I do like the way it starts, which is, one incident changes a lifetime.
Exactly. I think that for as much as we have, discrepancies as how that doctor, portrays therapy in the movie, that's a good, powerful line and good for helping people take responsibility and understand that, right. You can't just go around saying I'm sorry all the time for the actions. And sometimes it is just one action that does change a life. Well, very often it's one action.
Oh, yeah. We can all look back at one single incident that changed at least the course, maybe not the outcome, but the direction that you were moving totally changes, based on one thing. Mm-hmm. And, it's interesting that when we're talking about him being traumatized, and we do like to pull out what is real out of movies and analyze it. When you're talking about someone in trauma, and everybody can relate to this, you get such detail. You're there, right. He's describing. I see my wife's panties. I see the pants with the belt in them, yes. And the music's on. And if you wanted to, he could probably tell you the smells. He could tell you all these other things. Yet most of the time we go through life, we can't remember. It's like, where was I yesterday? Did I have lunch? You can't even tell that stuff. But when it's a trauma, everything's heightened, and he's describing it right there.
Right. It's like a photographic memory that no matter how much time passes, and certainly the pain can subside. But often we remember the vivid moments. And we now recently the whole country went through this collective recounting of a trauma, right? With the recent 9/11 anniversary, the 15 years. And everybody has a story. So if you have not thankfully had anything personally happen to you, if you're listening to this, you can think about how did you talk about the day of 9/11? What did it mean to you? What do you remember? Everybody talked about where they were that day, what they were doing, how it happened for them. So that became everybody's personal trauma. And so I think that that's an unfortunate reference point that we all have, that everybody understands what trauma looks like. And of course, for many, many people, that particular trauma was much more personal than just our memory recollection. But sometimes we do have these collective incidents that happen that cause trauma to everyone. But yes, we get all these heightened details of what a client or what a person remembers when they're recounting trauma.
And it bleeds over, or you kind of get stuck there. And I think that's what happened with Pat here, is this incident of his wife having an affair and then him beating up the teacher. He really got stuck on it, and he gets stuck with getting back together with her. And his goal is to do everything he can to, is it get Nikki? I think it's
Yes.
Nikki. Get Nikki back, or get her back in his life. And the whole movie is all built around this one mission. And it starts out with him practicing his speech as he's getting ready to get out, about what he's going to say to Nikki when he meets her again.
What, are you kidding me? Sundays? I love Sundays. I live for Sundays. The whole family's together. Mom makes brajol. Dad puts the jersey on. We're all watching the game. Yeah, it drives me crazy. And yes, I was negative. You didn't even know that I loved it, Nikki, but I did. I just didn't appreciate it or you before.
Come on, time to go.
I lost all that. I blew it. But you also blew it. We can get it back. We're going to get it back. It's all going to be better now. I'm better now, and I hope you are too. And I'm going to appreciate it. Hey, I'll be there in a minute, okay?
Doctor's waiting, let's go.
I'll be there in a minute. That's true love.
Oh my.
Yeah.
That's true love.
Courtney, I know you probably talk with your clients often about like positive self-talk to help them through a situation. So what do you think of this?
I think he needs to think about something else. Don't talk about Nikki. My gosh, it's scary to me that because it does happen. And that's why it's scary, because people get so focused on one thing, whether it's getting that job or getting that girl or getting your kid to do A, B, or C, or getting your spouse to do A, B, or C. It's like you a lot of times I just want to draw back their focus. It's like, why is him getting back together with Nikki all consuming? I mean, apparently he lost weight and he's looking good and he's exercising, and now he's going to do this dancing thing with this new girl, and that's because it's all about getting back together with Nikki.
Right. And so so many times people get stuck in these, they start telling themselves the wrong script to pep themselves up. And this one gets them stuck in this fantasy that is detrimental to his recovery even from the trauma. And and yes, it spurned a lot of positive behaviors, right? Because now he's like understanding, I have this diagnosis, so I need to maintain things. I lost 40 pounds. I'm reading books now that help me understand relationships better. So all positive stuff, but in the end, it's working towards a fantasy of a goal. And one that is, the writing's on the wall, she's gone, she's not responding to him, she doesn't want to hear from him. Everybody connected to him in his job. Like, I think at some point he runs up to he's jogging past the school and he sees the woman who's like the principal at the school, and she like runs scared from him essentially and tells him, go away, because he's stuck in this fantasy that all's good and everybody's just going to forgive him and move on.
And I think that's one of the things that should be different between friendship and therapy, right? Everybody would look at all what looks like progress, right? Exercise, losing weight, just doing positive things for yourself. And a friend would go, you're right on the right track. And a therapist would look at the underlying motivations and going, those are good things, but let's talk about why you're doing them. And if you're doing them for the wrong reasons, you're not going to get the ultimate outcome that you want. So let's not build your life around what look like positive, but are actually detrimental things in the long run.
Right. And, we should say we've talked, of course, the movie is based on him being bipolar, but we've talked about this theme of the trauma happening and what that looks like. And now this is something that becomes a theme through the movie of obsession. He even writes letters, or he thinks he's writing letters to his wife at some point. So it's all these like talking to her about, how things are going to be, how he's, forgiven her and gotten over what he's done and understood things differently. So he gets obsessed. And, we talked before about him being the identified patient. We have another scene that highlights that dad has his own set of obsessive thinking, yet, again, he goes undiagnosed. Not that I want dad diagnosed, but he certainly seems a bit OCD when it comes to football. And so we're going to play that scene and kind of show that the apple doesn't fall that far from the tree.
Yeah, and if we haven't said it before, we leave the cussing in on this one, so this is a rated R movie, so hopefully you saw the little explicit warning, because this is quite a profanity-laden speech, but it points to all of the superstitions.
You think I fucked up all the Eagles juju, don't you?
Ever since he was with you,
You think that I'm why today's happened?
That's right, you are why today's
I'm the reason why today happened.
I think so.
Let's talk about that.
Be my guest.
The first night that Pat and I met at my sister's, the Eagles beat the 49ers handily 40-26. The second time we got together, we went for a run, and the Phillies beat the Dodgers 7-5 in the NLCS.
She's right, Dad.
The next time we went for a run, the Eagles beat the Falcons 27-14. Wow. The third time we got together, we had Raisin Bran in the diner, and the Phillies dominated Tampa Bay in the fourth game of the World Series 10-2.
Oh, wow.
Fascinating. Let me think about that. Wait a minute.
Well, why don't you think about when the Eagles beat the Seahawks 14-7?
He was with you?
He was with me. We went for a run.
Really?
There have been no games since Pat and I have been rehearsing every day, and if Pat had been with me like he was supposed to, he wouldn't have gotten in a fight. He wouldn't be in trouble. Maybe the Eagles beat the New York Giants.
She's making a lot of sense, Pop. That's all right on all accounts.
Does anybody here happen to know what the official motto of the state of New York is on the official seal of the state of New York? Huh? Anybody? Do you? Do you know?
No.
Excelsior. Look it up.
Really? What?
Yeah. Excelsior.
Oh, Pat.
I wouldn't exactly call this an intervention.
No, but it's jumping on and counterbalancing Dad's obsession with
she's
with all of his
with fire.
superstitions. Right. So Dad's got all these superstitions, which we're looking at as obsessive thinking. Right, you got to wear this T-shirt. The sun has to be there. Things have to go a certain way in order for the Eagles to win. And Dad got it all twisted up and made assumptions and then projected it onto Tiffany. And man, she really blew everybody away, being able to give that recital of all those games and where they were and how, maybe the juju would have been on their side, in a different situation.
Yeah, and I that's why I think it's funny. She's like, because we would never do something like that, because you don't fight superstitions with superstitious. I mean, my joke is always, it's bad luck to be superstitious. And but we all have little things. I mean, but we don't put as much into it. Like OCD can be very, very scary.
Oh, yeah.
That you have to do all these rituals and complete the sequence and take multiple, take hours just getting out of your house because you have that.
Certainly.
But we all knock on wood and things like that, oh, don't say that, like I've said before, I say when I drop my kid off, see if I don't die. And it's like, oh, don't say that. People react like that. I'm like, if I can make it happen just by talking about it, then maybe I should talk more about like winning the lottery or, having awesome things happen to me, because coincidentally, if I say the word, it's going to happen, so we all have different little superstitions and it's not uncommon.
Certainly. I know I have some as well. And I used to actually have some OCD tendencies regarding, washing my hands and certain thinking that I had. And, the whole, I was the person who wouldn't step on cracks in the sidewalk for bad luck.
Right. But you knew that, and that's interesting. It is interesting oftentimes about OCD is they know intellectually that these things they are not going to cause it, but they're compelled to complete. And when you say, that's another thing, like OCD people use in common parlance. People say it in common language, yet they have no idea what really OCD, like you washing your hands 15 to 20 times in a day is not OCD. It's, if you really get to the place where your hands start to crack and dry out and you're spending all this time focusing on washing your hands, that's not necessarily that's I mean, there's a close balance. People are like, oh, I'm OCD because the pen has to be on the left and the pencil has to be on the right. Well, no, that's not OCD.
No, not right. That's right. Not necessarily. It goes with the thoughts. And of course I know it was a bit OCD because I had the thoughts that went with it. It was thinking that my hands were dirty when they weren't. I could be sitting in a living room and go, oh, my hands are dirty. I need to go wash them. And I'd be in the middle of a conversation and go, oh, I'll be right back. And I'd have to go wash them. But it's an anxiety behavior. And thankfully, I learned to manage my anxieties differently these days. So I don't have that anymore. But certainly my friends go back to like high school with me and early college. And they know, like I was a bit obsessed with that, but you're right. The neat stuff, I have probably 5 friends I can think of that whenever I go to their house, they're like, oh, don't mind this, I'm just OCD. And I'm like, well, if that helps you feel better about like being overly neat, okay, good. But it's not OCD because they're not doing it to relieve anxiety. And that's the difference, is that the actual behavior that you go through, they call it the ritual that you do, is to relieve the stress that is caused by the thoughts in your brain. That you have a thought that, oh, so I'm grimy, I'm dirty, and I sit there thinking about it, which many people with really distressing OCD have germ issues and fears of that. And I remember a person I worked with couldn't touch their shoes. They always had to wear like loafers because they could never put their hands on their own shoes. And so the person will have... What?
It's actually OCD is it has to get in the way of your life.
Yes,
too.
well they would spend all this time getting making sure like that. Say they drop their shoe behind a chair or a couch, they'd have to like go through all this stuff doing it so that they could get at it with their foot, not their hand. Okay, I mean, it's a silly example, but that's how that would affect this person.
And I think a lot of times people one of the things that struck me is someone was telling me that had their OCD. They were like driving to work and then they intellectually convinced themselves that they ran over somebody.
That's very common.
And then they had to go back. They had to go back because they couldn't leave a person. And yet there was they said, this is crazy. This is crazy. I know I didn't, but I can't not check. And so the anxiety was just going to heighten if they drove to work and finished that drive and didn't go back.
Right. And that's what we're talking about. So that distressing thought comes on and then the person engages in the behavior. So stopping the car, turning around and going back. And that you brought that one up, I think is really good because OCD and people who truly have that very distressing kind of secret, like, oh my God, I'm a bad person kind of thought, I must have run somebody over. It can take a lot of time for somebody, even sitting in the therapy room, to trust the therapist enough to say, this is a thought I actually have, because they don't realize that that's actually one of a common type of distressing thought that people with true OCD have at times, is that they've hurt somebody, that they've run somebody over. A lot of times there's impulse, they have thoughts of like killing people, and they'd say, oh my God, in a million years I'd never act on it, but I have these thoughts all the time when I'm doing the dishes. There's a knife in my hand and I think I should just do this. And they get so scared because they think, oh my God, am I psychotic? Am I turning into a killer? Or did I run 10 people over yesterday? How am I thinking about running people over that I keep checking and nobody's run over? It's so distressing for them to trust anybody to say these things, because these are deep, dark, ugly thoughts and they cause anybody distress. So, we have a lot in things that go on in therapy where we expect to hear about, people expect when they come in that it's easy to talk about having anxiety. It's easy to talk about having like mood swings and anger flare-ups and things that are very public and out there. But the private, ugly thoughts that happen with very distressing OCD kind of thoughts are things that are hard to even, that people need to really trust and feel safe in sharing that in the therapy room. So, yeah, I'm glad that you brought that one up, because learning that has really, that was one of the common ones, like, helped me then be a better therapist to people that I work with OCD over the years, because then it becomes like, oh, well, no, that's okay. And a lot of people have that thought.
Right, and that's one of the things that I think why it is helpful when you talk about stuff like that in therapy is because pretty much only a therapist or someone who's been down that road before can say, oh, that's normal for someone with your condition. You know, you're not the only one to ever suffer with this, pressing anxiety or distress in that certain way, or to have that certain thought pattern, because you and I can go, oh yeah, that's totally common. And they're like, no, it's not totally common. I've never met anybody else who said this before, and I'm saying it, and we're like, well, that actually, here, let me show you in the book. It's actually right there. Yeah. It's so common that they've written about it. So one of the ways is, and we've talked about it to help people, is treatment. Another way is chemical. So here's a couple takes on chemical.
So take your medication, and if you do fine, we'll reduce them.
Nikki's waiting for me to get in shape and get my life in order, and then she's going to be with me.
And that's better than any medication.
Pat, there is a possibility, and I want you to be prepared for it, that she may not return. True love is about letting her go and see if she returns. In the meantime, if you listen to that song, I don't want you to fall apart. So get a strategy, okay? You need one.
Let me just say something. I'm going to say something.
Okay.
This is what I believe to be true. This is what I learned in the hospital. You have to do everything you can. You have to work your hardest. And if you stay positive, you have a shot at a silver lining.
Work on a strategy, okay?
I do like, again, I like what the doctor did. He's like, yeah, that's all fine and dandy with your silver lining and do everything you want to do in order to get back with Nikki. But let's talk about an actual strategy that can help you long term. We haven't played the part that drives us crazy as therapists yet. Are we going to do that when he first meets the doctor? That's coming up later, right?
Yes,
okay,
definitely.
That's after this segment. Okay, so take your medication is what he tells him, and then maybe you can get back together with Nikki, but.
Right, and I think where you're going to about like just the whole like his strategy is just think positive, learn about things, have a great attitude, don't let things bother you. Like you can't think yourself out of bipolar. You can't, and and I think for other people, I think one of the common things when we have someone who's been depressed or someone who maybe is even manic and they see them as out of control, they'll say, well, just, go do something relaxing, or somebody who's depressed. Oh, just go see a friend, or, go to a movie. It'll make you feel better. Like, no, it's not, and you can do things, but when you have something that is like physiologically causing the reaction, that's the thing. When we have like physiological depression, we have environmental, and then we have, or situational depression, environmental triggers, or we have, biological. And we know that it's biological because people respond to medication at different times and in different ways. And, with him and his, it could even be that, if, in his manic like energy, that he's just thinking, I can just make this better. I'm going to feel better. I'm not doing anything violent, so I'm better. And but we can't, and we're going to talk a bit about, what bipolar truly looks like, and best practices for treatment, which includes meds and talk therapy. What's your take on it, Courtney?
Well, it was funny. I didn't even think about it the whole time we were prepping for this show. My father-in-law, bipolar, didn't get diagnosed, until after he retired. And one of the things that I looked back on it, because he lived in a different town, but he still lived in California. All of a sudden, I would get this call. Hey, how you doing? He says, hey, Courtney, how are you? I'm doing good. He goes, I'm at the Burger Hut. I'm like, you're in town? Yeah, I drove here last night. I'm like, you drove 8 hours last night? Yeah, I just wanted to see you guys. Okay, all right. He says, come and get me. Okay, all right, because he wouldn't take directions from me. And so, but it didn't get diagnosed till after he was retired, and he just kind of was left. He didn't have anything to do. He couldn't stay busy. He couldn't use that energy, that the ups gave him to do his job. So all of a sudden, he would be bouncing all around and coming visiting. One time I got a call from him. I'm at the 7-Eleven. I live in Vegas, and I met this guy, and we're gonna get rich. I'm like, okay. And so then he puts the guy on the phone, and it's clearly a guy who doesn't have his life together, and it sounds like he's pretty loaded. And he's like, yeah, me and your father-in-law, we're gonna get rich. We're gonna break the banks. We're gonna win. I'm like, oh my gosh, someone help this man. So a lot of times people can survive their lives and make do despite this chemical imbalance that maybe gets triggered by something like in our movie, or maybe just comes to people's attention after their life changes, like they make it a divorce or change a job or whatever. And then it's like, whoa, you had all your ducks in a row and all your plates balanced in that particular life circumstance, but then your life circumstance changed and now we become aware of it.
Right. And so, it took, and many people do manage their symptoms along the way in different ways. Some days they do things that are not the best choices, like pairing up with someone in Vegas that they don't know and, gambling all their money. But it doesn't necessarily look totally out of place, right? Because if you just know him to have a lot of energy and occasionally he just does crazy things, or right. wild things, it doesn't have to seem so off. But real bipolar is bipolar disorder is a real serious disorder. And it really does take, for as much as I'm saying you can't think your way out of it, it's biological. Like, and the best practices for someone with bipolar 1 disorder, meaning that they go very, very manic and they get very depressed and then they have little bits of in between, right? There is some stability and many times they might cycle only just a couple times a year, but there's real, we have these clusters of symptoms that a person has to have in order to get that diagnosis. So I think the worst thing, and I say my own pet peeve is, is people who just label other people that they know as bipolar. And especially, and I hate to say it, but in the dating world, guys do it all the time. They'll say, oh, my ex is bipolar,
Mm-hmm.
and
because she gets happy and sad.
Every time I hear that, I'm like, yeah, like that's, and I'll say, oh, she was diagnosed. Was she in treatment? Did she have, was she on meds? Oh, what was she on? Oh, she wasn't diagnosed. She was just moody. Oh, okay.
Right, exactly.
Right. And then, I'll move on from that one. But
she's bipolar once a month.
Yeah,
like,
right.
No, that does not count.
Right, and just because you get hormonal with your period does not mean that you're bipolar.
Yeah, or you cry at a commercial. That is not bipolar.
Right, or you get angry when something really triggers you. You're not bipolar. So bipolar, I did pull up the diagnostic criteria. I'm not going to go through all of it, but I thought it'd be, fun to kind of talk about what it really looks like, and you and I have both worked with people who have had like life debilitating bipolar disorder where they can't function and they are on disability. Now, most people are not. Most people can live nice functioning lives with bipolar when they know that they have it and they're getting treatment. But the best practices is medication management along with talk therapy. And the medication can help them because a lot of times people will say, well, just give me the medication then. Why do I have to do the talk therapy? But the talk therapy is to help them learn the coping skills, understand what their triggers are, how to manage their emotions when they're in it,
and you can see it coming.
Yes.
As a therapist, you can be like, you're. I wonder if they need to reassess your level of medication because you're starting to bump into a manic, and they won't notice it, right? So if they're just talking to regular people, they're like, finally, these medications that made me feel dull, I'm feeling sharp again. And you're like, I don't know, you're feeling sharp. You might actually need to have I don't even know the milligrams and I don't write prescriptions, but you might have to have a 5 milligram bump or something because you're starting to get out of balance. And that's where some of the therapy can help too.
Right. And, so the diagnostic criteria, and when we think about it, we may know people that look like this, but when it's all put together, it's a very different picture. We might have some people that kind of ride a high energy, a lot of times and might be hypomanic, but it's not even the same as manic. So persistent, elevated, expansive, or irritable mood at least 1 week long. And then with that mood change, they need to have at least 3 of these symptoms. So inflated self-esteem or grandiosity. So like thinking all of a sudden they're going to switch careers, or they're going to run for president maybe, or rule the world. Decreased need for, or open up a business. A lot of times people will come in and have this, all of a sudden they'll have a new idea. I was thinking about opening up this business and blah, 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 blah. And you're like, oh, well, you had a really stable job and you still have that job, right? And then you work with them on like, okay, well, if this is going to be a real plan, let's look at that and see if it's not being affected by something else, because it didn't seem that you had this plan for the last 6 months that we were talking. So now it's become this over-focused idea. So inflated self-esteem or grandiosity, a decreased need for sleep, and literally a person can go a couple of days with no sleep, and they'll say, oh, I just couldn't sleep. And it's funny how resistant. Do you find people get resistant when you talk to them about their need for sleep at times?
Yeah, because it's awesome. I mean, right? And sometimes they're like, they only need 3 or 4 hours. And then they're going. They're like, I am more productive and getting more stuff done than I've ever gotten in my life. And you just want to killjoy it. You just want to med me out. But my house is amazing. I got all these plans. I'm making friends. I'm happy. Why would you want to crap on that? I'm going to go buy a car, and I ordered 10 things online the other day, and it's like, whoa. Oh, my credit cards are almost maxed. So there's all these other things. But yeah, the decreased need for sleep is, and that's why it's hard. And maybe we'll talk a little bit. It's hard to keep bipolar folks on their meds, because the highs are high. You don't get that high anymore, and they start to feel like, okay, well, I'm kind of even out, so I don't need my meds anymore. It's like, I don't think the chicken and egg thing's working. I don't think the reason that you're feeling okay is because you don't need your meds. It might be because you're taking your meds.
Right. And I definitely want to talk about that. We'll go through these last couple of symptoms and then talk about that for a second, because that's a really good point. So increased talkativeness, right? So, and they literally sometimes can sound like a different person. They can be so fast paced that they almost sound like they're not even the person you met with last week.
And the way I notice that is I start to feel anxious when I'm with them. It's like, wow, I've known you for months, and all of a sudden you come in this time, and I'm like, feel like I'm on the edge of my seat, and I'm having to listen like crazy, and every time I'm talking, I'm interrupting you. I can't. There's no pause. There's no letdown in the conversation. It's like I almost want to wave my hands in the air and go, oh, wait, time out. Take a breath. And so I notice it in me. It's like, oh man, this person is really pressured.
Yes. And then it's called flight of ideas or racing thoughts. So just kind of not being able to shut the mind off, which as we're talking about like this obsessive kind of thinking that Pat is demonstrating in the movie, that's where that would fall into the diagnostic criteria for his manic episode, is the racing thoughts of like, I got to get her back. And it just stays with him that's his motivation. Distractibility, increase in goal-directed activity or psychomotor agitation. As you said, the person who says, my house is clean, I'm being productive, I'm getting things done, I wrote 3 books, whatever. Like it all happens all at once. And then increase in risky behavior. Now that used to be like, I remember when I first started out as a therapist, people would be like, well, did they run off to Vegas and have like a bunch of sex? And did they gamble all their money away? Did they go out and have a binge, drinking all weekend? And so sometimes there's like telltale, like total action-oriented, out of the norm behaviors for people. It may not always be so dramatic, but
right.
That's
it could be like my father-in-law just coming to visit on a whim. It's like, wait, you got a job, and I didn't even know you were coming here.
Right, leaving everything overnight and driving in the middle of the night, 8 hours, right, no sleep. That also indicated that he didn't need sleep that night either. So you're getting this call at 8 in the morning going, what? Yeah, didn't you sleep last night? So you'd need to have, you'd have the irritable mood and then one of those 3 symptoms, and then it also level of severity sufficient to cause social or occupational impairment, hospitalization, or psychotic features. And of course, that is not induced by a substance use episode. So, but that's, for anything to be a diagnosis, that's where I said the pet peeve about the guys complaining that their exes are all bipolar is, true bipolar impairs a person's ability to function at their normal level in their life. It stopped this guy from being able to be a teacher. He was a school teacher. And social or occupational impairment, right? I mean, like that's how any of our diagnostic criteria, I think all of them have that tagline of that it impairs their social or occupational functioning. So
it has to get in the way.
Yeah. So you were talking about the medication.
Yeah, there's a great scene.
Oh, yes.
Where they're at dinner, and it was I love it. So we'll just go with this. This is Tiffany and who's our main guy again?
Pat
and Tiffany talking in front of her relatives over dinner.
What meds are you on?
Me? None. I used to be on lithium and Seroquel and Abilify, but I don't take them anymore. No. They make me foggy, and they also make me bloated.
Yeah, I was on Xanax and Effexor, but I agree I wasn't as sharp, so I stopped.
You ever take Klonopin?
Klonopin, yeah.
Right?
Jesus.
Like, is it what?
Yeah.
What day is it? How about Trazodone?
Trazodone.
Oh, it flattens you out. I mean, you are done. It takes the light right out of your eyes.
God, I bet it does. I'm tired. I want to go. No.
Okay, that was a quick change on her part there.
Right, and you know, with the meds, those are all the good standbys, right?
Yeah, I recognize all those now. I usually say Trazodone.
I was gonna say I've never heard it as Trazodone.
Yeah,
but and interesting, they're naming all these, you know, pretty standard medications that people
heavy duty ones too.
Yeah. And notice, so both of them said, yes, I'm supposed to be, or I was taking them, and now I'm not. I stopped on their own. And that's exactly the point you were talking about, is that people often will say, I don't like how it made me feel. Now, I think one of the biggest core issues with that is that bipolar, as you said, like there's positive reinforcement for manic episodes in a lot of instances, right? You become productive, you might, you know, do some great things, you know, temporarily, but then you crash and burn. And maybe you even do self-harm when you crash, you know, or maybe you're doing harmful things to yourself because you might be, you know, able to be super productive during the day, but you're drinking yourself silly at night, you know, because of the impulsive behaviors going on. So the problem is that when you put somebody on mood stabilizers, that is what it does. It's a mood stabilizer drug. So it levels you out. He said it flattens. But if you're used to highs and lows, having, you know, normal range of emotions doesn't feel like a range of emotions, you know, and that's one of the biggest issues, whether it's treating someone with, you know, medication management and talk therapy and bipolar, or whether it's like a person who got recovery from drugs and they're used to the super highs of the drugs, is teaching them like what to understand as like a normal range of emotion. Well, how do you know what joy feels like if joy has been jacked up for years, you know? And how do you deal with sadness without being afraid you're going to go and have suicidal thoughts, you know, because then people can get very scared of going the opposite direction. So I know you were mentioning just kind of having people stabilize and go, oh, I'm fine, and trying to go off.
Yeah, people, and that's common for people that have, you know, whatever chemical or whatever it is, bipolar, where they don't want to believe that they need this medication. And I think of it sometimes like diabetes. You have to take your insulin. Mm-hmm. You know, it's like you wouldn't deny their body's not making insulin. So they'll need to be on insulin for probably the rest of their life if they have the right kind of diabetes. Why would you say that, oh, well, now I'm okay and I don't need this chemical added to my body through my medication? Well, you probably do, because it's a chemical. It doesn't just come and go. It's not like, wow, I had a rough, you know, month because I was going through this crisis. No, these are things that cycle, and your body's not just going to start making the chemicals in your brain in order to even you out. So that's the struggle that I see. I heard someone describe it as putting like a piece of bulletproof glass between them and the world. Oh, you know, that
interesting.
When they were on their medication, they're like, I see it. It impacts me. It's not like I'm not affected and I don't know it, but it's almost like I don't get down about it or I don't get super up about it. It's like it takes, I always think of it in sound waves because I'm in podcasting. It takes all your wild sound waves and squishes them together so you're living right in the zone. You're not overblowing your speakers and you're not where you can't be heard. It's right there in the middle, which sometimes people might think is boring, but it's actually kind of normal.
Yeah. Now, do you know the boiling pot analogy? Because I like that one that you just gave, and it sounded similar to that. Do you know the boiling pot analogy for meds?
Like you're letting off steam?
No, like when I have someone, not necessarily with bipolar, but I could see it for this as well, but somebody with like severe depression or anxiety where they wake up and they're having panic just by waking up for the day. I'll talk to them about, that they have, when you put a pot of water on the stove and you put the lid on, the pot at some point will boil over, and when you take the lid off, the water goes down, right? Subsides a bit, and you have some room then. You could even add more water to the pot if you wanted to, and it can boil, but it won't boil over. And so I talk to them about like explaining how medication works is I'll say, you know what? Your pot your emotional pot is already full. When you wake up, your water's at the top, the lid's on, and if anything goes wrong that day or is out of whack, like you don't have any room and your pot boils over immediately. And I'll say, when you take like a daily antidepressant, anti-anxiety kind of medication, something that's just not an as needed, but something you take every day that goes in your system, it builds up, and over time, you'll notice that you have more room to implement the coping skills that you're learning, or to reach out and ask for support when you need it, and that kind of thing. It allows for your day to have things normally go wrong as they do in life, and it won't feel so overwhelming. And so, and that seems to help people really understand how that works, because when you take medication, and we should say too, neither one of us are actually medical doctors, so we're not really talking about, we're not giving medical advice here, just giving information.
And we're also not talking about you. Whoever's listening, we're not talking about you.
That's right.
We're not diagnosing you. We're not treating you. We're just sharing our experience of working with folks who have been in similar situations and what has worked and what has helped them. And if you feel like you fit into any of these, see if you can get a diagnosis. Go and talk to a therapist, to a psychologist, psychiatrist. Even physicians are pretty good at least starting to know that there's something that they need to refer for.
Yeah, and that's the point, is that now today I think that they're getting more on board with referring out to a therapist. I have a lot of doctors I work with that do some great referrals for really accurately needed, referred patients. And so the medication over time, like when you take an antidepressant or anti-anxiety med that you take every day, like a Paxil, Prozac, something like that. There's newer ones too, but I kind of like those. They, after like 5-6 weeks, you might notice they're not happy pills. I always say they're not like happy pills. You're not going to take and go, oh my gosh, I feel better. What you notice is that after 5-6 weeks, maybe 8 weeks, you start going, oh, I haven't been quite as depressed as I was before. Or, oh, like I haven't had a panic attack in 2 months. It's things like that where you just notice that you're functioning better, and like your mood struggles are not like as painful as they were before. And then, of course,
it's boring. It's boring.
I was saying, and then we get into the point where they're like, oh, well, I haven't been as depressed as I was 2 months ago, so maybe I don't need these meds anymore. And then the whole cycle begins with, well, why am I on these? And how long does this have to last? So between the therapist and the doctor, it can be a really good treatment, little treatment team to kind of plan what works best for each person, because we're not saying that people have to be on medication the rest of their life for things. And in fact, I'm a person who likes to kind of see how a person can learn skills without medication. The only time it really comes into play is when you have someone with true bipolar 1 and you hear the history of how it's played out. Then you're like, you know what? This is really the best practices, is taking something and planning on doing it for the long term, as if you were diagnosed with diabetes and you have to have insulin every day. It's just another illness.
Yeah, it's and you can also learn to look at your own life and examine it. You're like, wait a minute, I'm doing more shopping. Wait a minute, I'm getting kind of what I would call, antsy feet. I feel like I need to get out of this job or out of this relationship, and I can't even think about why.
Yeah.
It's just, I feel like I have to. And you go, oh, this is it's starting to come on again. Yeah. Or maybe I just changed my dose or whatever. It's like, and so instead of just acting impulsively on it, you can kind of look at yourself and observe yourself and go, maybe I need to do something different than what I'm doing right now. So hopefully they're going to good therapy, and it's not therapy like this doctor.
Right. I can't wait. This scene is crazy.
Okay, so what
Bad doctor.
Yeah, bad doctor. So he goes in to meet he just got out of the psych ward, and the mom is taking him to therapy the first time, and he's signing in the lobby, and this is how it goes.
Is that song really playing?
We have music sometimes.
That song is killing me. Could you please turn it off?
I can't.
What do you mean you can't?
I don't have the controls. I'm sorry.
Did Dr. Timbers put you up to this? Is there a speaker here? Is it a speaker here?
I'm sorry. I'm sorry. I'm sorry, okay? I'm sorry. I'll fix all this, okay?
Okay, so his doctor triggered him.
Yes, and the extension of that scene is him sitting in meeting the doctor for the first time, and the doctor saying, well, I just wanted to see if that song would still trigger you. Like, oh my God, bad doctor. That is not what therapy is like. Just in case you are listening and thinking, oh, maybe I should go talk to somebody, you should never expect to be treated that way in a psychiatric office.
No, I could see in like a cognitive behavioral desensitization, maybe like with a phobia, you would start to introduce, well, let's listen to a different song by the same artist or something like that. But you would engage consciously with them to make a plan.
That's the point, right? Is that you'd be working in the room with the client going, okay, like we're going to work up to listening to that song here in the office. But he's coming in and just purposefully being experimented on, which is wrong.
Right. There's not many movies that I really fully agree with how therapists and therapy is portrayed. Most of the time they end up sleeping with their clients, which I gotta say, really, really, really against the rules.
That's right. And really, really, really is a rare occurrence,
Yeah.
It's not, and the movie... Oh, gosh. Yeah. Movie portrayal and TV portrayal of therapy is not usually accurate.
Okay, and then I pulled this one just because I think this is almost like what a friend would do, but here's the therapist weaving how he can make good things happen for the wrong motivation.
Yes.
Pat, the silver lining thing is yours. I'm just giving back your words to you. This crazy, sad shit, as you call it, made you a happier, calmer person with a beautiful, positive philosophy of going outdoors, working out, and reading books?
No, not the books.
You said Nikki is friends with Ronnie, Veronica, and Tiffany. So if you become friends with Tiffany, Nikki will think that you're a kind, generous, large-hearted person who helps people in need, who is basically thriving. So if you help Tiffany, it will be good for you.
No, please. All he's doing is saying, okay, so every single thing that you're doing that's positive, relate it back to the relationship that you shouldn't be focusing on.
Right. Again, I mean, like, how terrible is that, right? We were talking before that his own positive self-talk is keeping him stuck in this fantasy, and now the doctor is replaying that out for him. So wrong. And I mean, I can think of, as I'm sure you can, there are people that ask us all the time, if I do this, will she come back to me? Right. Or will he come back to me? What do you think if I do this? Do you think that's going to get their attention? My advice to people is just like, live the life that best suits you, makes you feel good about yourself, makes you a confident person, and you will feel better about yourself no matter who is in your life or who you attract at that point. It is no longer about attracting the same person.
You see this type of thinking a lot with teenagers, yes. Right? They just want to focus on what they want to do, and they want to present a certain way, so they key everything they do. Like they'll get mad at somebody and they'll go, well, I'm going to be successful and that'll show them, or I'm going to do this better than them, and then they'll get what's coming to them, and they'll know that I'm not this person. And it's like, whoa, you are giving this person the power over every single piece of your life, mm-hmm. because you're going to, people do it with their parents too, right? I became a successful A, B, C, or D. I'm now an attorney, and my dad always wanted me an attorney, and I showed him, and now he's going to love me in the way that I want. And it's like, he'll say, "Oh, you're that kind of an attorney," and he'll just crush your dreams. You'll be the wrong kind of attorney or something, or you haven't done a case that's big enough. So people they focus all of their life, which I consider giving away all of your power to be happy and content, because these are things that you actually wanted to do for you. Instead, you're doing them in order to get Nikki back, or to get this job, or to prove your neighbor wrong that you're not a messy, yard keeper or whatever. It's like, see, I hope he sees me mowing. I'm going to show him. I was like, what? I don't care about your neighbor. Just, do you like your lawn mowed? Mow for you, for Pete's sake.
Yeah, absolutely. And the, and kind of showing how, I like how you showed how, like, as adults, we do it in so many ways. I see it a lot, though, in love relationships and adults that are breaking up. I work with a lot of people in transition in their lives, usually out of a relationship. Mm-hmm. And I hear it all the time from adults, whether it's men or women. They kind of get stuck in that, like, I kind of wasn't happy, but I didn't want this to happen, and now I need to try and get them back. And it's hard to get them a bit unstuck from that, except to kind of just keep going. You know what? What is it that, besides wanting them back, what other things do you want in your life? Are you living that life right now? Because we need to get you doing stuff that is going to get your focus shifted just a bit. Yeah, even they'll pick their next partner going, okay, well, I know my ex never really liked her, but I kind of liked her, so now I go out with her just to show my ex that I'm out, and I'm going to go to the place where we used to always go, where I know where my ex goes, so they'll see me with this woman, and I'll just be heaping coals on their head. It's like, really, you're dating someone out of revenge? That's really not a healthy way. I wouldn't want to be the revenge datee. Yeah.
Don't date me because you want to get back at them. I have no room in that my life for that type of thing. So now we've talked a lot about how bipolar, and if you have I think you have the DSM right there, but the Diagnostic and Statistical Manual of Mental Disorders, bipolar is very, very thick, because there's so many different kinds of bipolar. There's bipolar 1, unipolar, single event. There's like a million different ways you can be bipolar, and you've been talking about the main one, which is bipolar 1. But there are also things that are just normal life. Sometimes pressures of life, relationships, jobs, money, kids. These are all things that can get to us, and people think, if you just describe some of the little behaviors that you just read, people in normal life, regular, just their friends and family, they go, well, I've experienced that. And I think even as you probably had the same thing that I did. But when I'm going through and learning about all the diagnoses, I'm like, ooh, that one's me. That one's me.
Oh, of course.
I've done that. Yeah, we've all done that. So, but sometimes they'll try to relate to someone who has a true mental health diagnosis that they need to be medicated for, and people will try to relate their own situations to it, like his, I guess.
This is his friend.
His friend. That's right, his friend.
Tiffany's. It's Tiffany's brother-in-law. So,
right.
Yeah.
But his friend. Okay, Here he is.
Yeah, we're doing all right, man. I can't complain.
Isn't the market down, though?
It is down, Bill. But she wants more, so I'm giving her more, man.
My dad lost his pension.
I'm sorry, man. A lot of people, man. My uncle, too.
Really?
Yeah, but you know what? No disrespect. It's not personal, but this is the time to strike. You start snapping up commercial real estate, cheap. You flip it over, and that's when you make the money. But the pressure, man, it's like...
You okay?
I'm not okay. Don't tell anybody. Listen to me. I feel like I'm getting crushed. And
crushed by what?
Everything. The family, the baby, the job, the fucking dicks at work. And it's like, like I'm trying to do this, and then I'm like suffocating.
Holy shit.
You can't be happy all the time.
Who told you can't be happy?
It's all right. You just do your best. You have no choice.
That's not true at all.
You just can't.
Ronnie.
I hope you're okay with Veronica's sister coming over. Are you okay with that?
Who?
Veronica's sister.
Tiffany and Tommy?
Yeah, just Tiffany.
So he was trying to relate, right?
Yeah. And, I think it's interesting that when people, like, you find out your friend got diagnosed with something or struggled with something, often then they become the confidant. Like this guy then comes over to the side and was whispering with him and saying, and don't tell anybody, but I'm not okay. Like all of a sudden you become the person that people want to confide in and say, well, you've gone through a lot, so you can handle what I'm going to tell you, or you're going to be able to relate to what I'm going to tell you. And I think it's funny because Pat, in this instance, as you said, he's trying to relate, but he really sounds like he's standing in this position of like, I have no idea what you're talking about. Like, what do you mean? And
Why can't you be happy?
Right, because he's better because he's reading his books and he's doing his thing, and he's going to get Nikki back. And so this friend is falling apart trying to keep up with the Joneses, buying another house for the wife and things like that because she wants more. So.
Yeah, and then you also have the family members, and oftentimes we talk kind of about how mom is kind of, she's the enabler or kind of just the balancer, right? She's trying to make everything okay. If her husband needs certain things to happen on Sunday in order to keep his superstitions alive, she's going to make sure those things happen. But family members don't always know how to interact, and sometimes people just kind of get verbal diarrhea and they just start to talk. And so here's Pat is talking to his brother and the awkwardness that comes from that.
So, listen, I'm sorry that I didn't come see you down at the hospital. Those places creep me out, and the firm's been expanding. I've been helping Pop with the restaurant because he needs to have a legitimate business. He needs a tax return. Of all the money that he's making with his bookmakers, they're going to come after him. And it looks like I'm going to make partner at the firm. What? I don't even know what to say to you anymore. You lost your wife. I'm getting engaged. And I want to be able to tell you about those kind of things. You lost your house. I'm getting a new house. You lost your job. Things are going great for me at the firm.
Maybe stop talking about all the stuff that's good for you and bad for him. Just, leave it alone. Leave it alone. We're watching the game.
You know what? I'm just gonna stop talking. I'm gonna shut my mouth.
As my friend Danny would say, I got nothing but love for you, brother.
That's right. That's right.
That's nice.
That's nice.
Wow, thank God, finally.
So who pulls it out but our crazy one, right? The Pat. He's like, no, man, I got love for you. I don't hate your success. But the brother is just so awkward. He's like, I didn't come over because I hate those places, and things are great for me and terrible for you. So there you go. Sorry, I don't know what else to say.
And of course, that happens all the time too. I think this movie really just kind of honed in on really great with the friend and the family dynamics of how to relate to somebody, or awkwardly or not relating to someone that you care about now with this new diagnosis and what this looks like, and kind of thinking of them with a mental illness. But I think this comparison stuff, this stuff happens whether anybody's diagnosed or not. We've got siblings all the time. People don't relate to each other and they go, I don't know what to say to you. My life looks like this, yours looks like that. And it may not even be a bad or good, bad to good comparison. It may just be like, we have nothing in common. So why would I don't know how to talk to you.
I remember when I was going through my schooling and learning about diagnoses and things like that, I was thinking, man, I don't think I've seen hardly anybody who fits any of these for real. And because everybody I knew, I could say, well, they're normal in this way and normal in that way. And even in this movie, there's some real wisdom that comes from, the people who are supposed to be on medication, so it doesn't, and I think that's what people oftentimes will look at. They're like, well, they're not bipolar because they're functioning in life, they're maintaining relationships, or they don't have a panic disorder or an anxiety because look, they just came over to my kid's football game and they, I saw them at PTA and all this stuff, and it's like, you don't know everything that's going on behind the scenes. And just because someone has a diagnosis doesn't mean that they have no wisdom, no forethought or insight in their life, but they still go through these highs and lows, or they're so depressed for a week that they can't leave the house. But you'd never know that, and even it doesn't make them stupid either, because a lot of times people can see their own relationships and they have a diagnosis, so people think, well, wait, no, they just said a really smart thing, and look at that big thing they accomplished, so they clearly wouldn't have a diagnosis, but they do. And just because you have a condition doesn't mean you're not smart. Just like this one, which I pulled from our they meet up running, and it's in part the way I feel like men and women have to fight differently, but it's also some wisdom that she's learned through the course of her treatment.
Hey! What the fuck? I'm married! So am I! What the fuck are you doing? Your husband's dead! Where's your wife? You're crazy! I'm not the one that just got out of that hospital in Baltimore. I'm not the big slut!
I'm sorry. I'm sorry. I'm sorry.
I was a big slut, but I'm not anymore. There's always going to be a part of me that's sloppy and dirty, but I like that with all the other parts of myself. Can you say the same about yourself, fucker? Can you forgive? Are you any good at that?
So I like that, especially because, yeah, we all have parts of ourselves that we don't like, but are we able to be gracious and understanding with ourselves and give ourselves a bit of a break and understand? I mean, if anybody should be able to understand ourselves, it's us, right?
Right.
But oftentimes we're the hardest on ourselves because we think we shouldn't be like that. And just because she should be on medication and she's been through this heavy loss of her husband and all the motivation, all the guilt that she felt because she felt like she was a part of it, she's like, hey, but I learned to forgive myself. Can you?
Mm-hmm. Yeah, and of course, Pat is running through the movie like I think it's the shame of losing his wife and not accepting that his actions had consequences to it that were dire to his marriage. I mean, hers did too. I mean, she was having an affair with a guy in the shower. Like she did actions to their marriage that had dire consequences for it as well. But that he is running on shame he needs to get her back in order to validate that he's a good guy. Is kind of how I see him. He can't forgive himself, and that's why he's so overfocused on getting the wife back, because he's convinced himself that that's the way that it's going to validate his that he's a good person. He's not the guy that pummeled the teacher in the shower. Right. He's the guy that, and if Nikki can love him again, that means that he's good. And he's trying to say, I'm not good. I'm not crazy. So I think that is all like shame based, and he can't forgive himself, or hasn't at that point in the movie.
And men and women fight differently. And you're a woman and I'm a man. And we can't throw the haymaker. We can't throw the nuclear bomb because not like women can. Because I always feel like my wife could fight dirtier than I could, or let's just say women. Let's not say my wife. But if I know, because if I say some of the things that I think would win an argument, I don't know if there's winning an argument, but if I say if I threw my knockout verbal blow, I think that knockout verbal blow is going to knock me out 20 times in the next 6 months, because she's going to bring it back up. Well, you said this and that. Well, I was just mad. I was just wanted you to back up. I just, was trying to keep you at bay. It was like a lion tamer with a chair trying to keep you at bay and stop attacking me. So I just attacked you back. And that's what he does in this one.
Yes.
He calls her a big slut, and she's like, "Grr." And then he has to apologize, even though she called him, I'm not crazy. You're the one in the mental institution. But, so yeah, I guess us men, what? We're tougher? No, I don't think so.
No, you're just more scared of us.
We should be.
But and I think in that point though, the attack for attack, certainly that doesn't get anybody anywhere in a relationship. It's deal breaking, or relationship can be relationship ending over time, because if that's how the couple argues with each other, they're not going to survive, because there's so much damage that gets done when you do those nasty, like you're a slut, you're a B, you're whatever.
Right.
Or even to the guy, you're a loser, you're, worthless,
right.
Things like that. You do so much emotional damage that relationships like that can't survive unless there is a lot of attending to repairing that damage. And most of the time we just want to make sure that the damage just doesn't follow us around. So we act like, oh, I'm sorry, honey. And we act like it should just be okay. And that doesn't repair damage.
No, you just go on as though it didn't happen. That doesn't really work. I mean, it may keep the peace for a few days,
yeah,
or a few weeks, but ultimately it's going to come out like, you said I was just
right,
like my mother.
Those wounds are raw, and even like the stuff that I practice with people, there's actually a formula that for every one time you call someone a name, a loser, a slut, or whatever, you have to do 5 positive statements to them to repair the one nasty statement. And that's like a research-based formula that that, is out there. And so that's how damaging it is.
I'd buy that, except for I think even if you do after you do the 5, it's like erasing a pen. You could do a lot to repair it, but you're never going to make it all go away. That never goes away.
And that's why you really don't want to have those things in a relationship at all. Yeah. But we all do a little damage here and there. We all have arguments. Things get said. They don't have to be so detrimental that are like, and I like that analogy of like the erasing the pen. You can still kind of see the line, but it makes the wound start to heal, right? Like right. It kind of makes it a bit better. But we don't want to be calling our partners losers or sluts or bitches or whatever. Anyway,
no,
but
it's even in real life. At least at my house, it's different. It's milder than that.
Yeah.
I've learned, like, she walks out wearing something. She's like, "Does this make me look fat?" I don't know that I've learned to answer that question well.
I don't know why she would still ask that question.
Yeah, exactly. It's like my answer is always.
And I've seen your wife. She's pretty cute.
That's my answer. Is you look beautiful, honey. What am I going to say? That's why I don't like going clothes shopping with her, because now all of a sudden it's like I get to evaluate her in these clothes, and I'm like, no matter what, if I'm commenting on the clothes, I can't comment on the clothes without commenting on her, and I can get this wrong, because if I start out not liking it and she buys it, then we're in trouble. But when we get home and she owns all the stuff, I'm like, I love her and everything because we own it. It's not going anywhere. If I say something bad about it, it's going to sit in the closet, and we paid for it, and now we wasted that money.
And if she bought it, she thinks she looks good in it. That means you should think she looks good in it. So that's the answer.
Yeah. Yeah, I always tell her, I say, I'll love you even if you're wearing nothing, but that's me, I'm sure.
Woohoo! Yeah.
Yeah. Okay, so it wouldn't be a romantic comedy on the Crazy Train if we didn't have this ending here. But before there's an ending, there's a dance scene that I think you wanted to talk about.
Right. So so we watched this movie. We knew this was happening. And I happened to be at a wedding in Ohio last weekend. And I was actually officiating at it. And one of the girls in the wedding party came up to me, and she didn't know we were even talking about that. I don't even know how I walked into the conversation on Silver Linings Playbook, but she said to me, and I think she related as having bipolar, and she said, that end scene is a metaphor for a person with bipolar who's not on medication. And what she's talking about is that throughout the movie, there is this love story intertwined in it. We haven't talked that much about it, but it's between Tiffany and Pat kind of bonding over their heartbreak, and Tiffany thinks that she's gonna help Pat, surreptitiously by kind of sending letters, or he thinks she's sending letters to the wife and stuff, but she does that in order to get Pat to participate in this dance contest with her. And at the end of the movie, this dance scene that they do must run through, 10, 15 songs, I think. And it goes from like slow to fast to rock to slow to happy to sad. Like, it runs the gamut. And so this person coming up to me saying this, she was saying, like, that is the metaphor. That is what bipolar feels like when you're not medicated. It feels all over the place. It feels like all those moods that were taken apart in the dance scene. So I just loved it and was like, that's brilliant. I'm totally going to talk about that on the show.
Yeah, and I'll see if I can put that music montage in here, and then people who haven't seen it or don't remember, because even you and I who have watched it in the past week, when you brought it up to me, I'm like, what song? What are you talking about? And it was just the natural way that they progressed. So I don't know. Well, let's have our opinions on their relationship after we hear this final letter.
Just leave me alone.
Wait a second. I have one more letter for you to read, okay?
What the fuck is the matter with you? Give it to her yourself.
Hey, let me say something. You don't ever have to see me again if you just read it, all right?
This is so fucked up.
Yeah, just read it.
Dear Tiffany, I know you wrote the letter. The only way you can meet my
crazy was by doing something crazy yourself. Thank you. I love you. I knew it the minute I met you. I'm sorry it took so long for me to catch up. I just got stuck. Pat. I wrote that a week ago.
You wrote that a week ago?
Yes, I did.
You let me lie to you for a week?
I was trying to be romantic.
You love me?
Yeah, I do.
Great. Now they'll live happily ever after.
With lots of ups and downs.
Yeah, lots of ups and downs. It was hard. I couldn't take my therapist hat off at the end here. I'm like, now we got two crazy people that are going to get married, and what's that divorce going to look like, and what's it going to be on a night-to-night basis? Because you should have somebody who's relatively one person maybe somewhat stable at some point in a relationship, but they fell in love. What are you going to do?
Well, see, and I have a different take on it because I think, two people have, I think there's only 3% of time any couple is on the same page anyway when it comes down to it, ready to talk about the same things or at the same level of energy, 3% of the whole lifespan of a relationship. And, people bond over stuff all the time. And these two people bonded over the losses of their spouses. One was divorce, one was death. People bond over tragedy all the time. These two also happen to have bipolar, so yes, it's going to be their fights, man. I don't want to be a fly on the wall in in their house when the arguments start. But and because they are because I think that we'd be harsh to say two people with bipolar. If you're aware of yourself, you're being treated, you're taking your meds, you're doing your therapy, you can live probably as normal a relationship as most anybody else, right? Because we all have our ups and downs in relationship. I think the problem is that these two are purposely not following the treatment plan, purposely not being medicated. So they're just letting their freak flag fly, and, and the emotions will come as they may, and they'll just deal with it and all that stuff. And yeah, sure, there's probably going to be some problems in there, but I thought it was sweet and romantic, but that's how I am. I like a happy ending.
It was, and maybe they would be good together, but as you do in movies, you put yourself in the character's position, and if I'm him, no thanks. Just saying, no thanks.
But if you were him, you would want her because you've got that energy together.
Yeah, I'm just not that good at not being me. So I couldn't put myself in his position. I was in my position, and I wouldn't have been chasing her. I'd have been like, all right, see ya, good riddance. But, that's just me. It doesn't end happy like that if I'm making the movie and I'm in it.
Yeah.
No. You want to talk about living a medicated life. I am right in the middle. I keep things right in the middle. At least I do the best I can for me. Mm-hmm. With my chemistry. So her ups and downs scare me. So she would run me over and with her emotions. So but anyway, all right, that's enough about me. You always turn it about me. So
it's always about you, Courtney.
It is. Isn't life all about... My life is all about me, that's for sure. So how do they get a hold of us, Colleen? If people want to know more or connect with us, how can they do that?
Right. They can find us on Twitter at shrink2shrink with the number 2 in the middle. And then you're also at QuadFather MFT. And I'm also at Dr. Colleen Mullen on Twitter. We both have our other podcasts, the Quadcast you have, and I have Coaching Through Chaos. Now, Coaching Through Chaos, there's 40 episodes, and we've been on hiatus right now. I'm racking up some really cool interviews. I can't wait to tell people who I'm getting for January, though. We're launching January 1st of season 3. So it's going to be a rather long hiatus. Last episode up was July, but we've got 40 episodes that people can listen to on all sorts of things, life management or cool stories of resiliency, really cool personal stories. So we're going to go with that in the future as well. So, and how often is Quadcast on?
It's pretty much on every week, and it's just us telling silly stories about ourselves. I think I just got telling the story when I got pepper sprayed. So that was really fun. So we just do silly stuff from our lives, and we're up just about every week. So we play games, and I played the Doodlywed game, and we played some Family Feud type stuff, and so it's a departure from the serious nature of what we do for a living. So we have a good time there. And we are Shrink to Shrink comes out usually on the last day of every month. And I think we're up to, 8 episodes now?
Something
or 9
like
episodes,
that,
so.
yeah. And we really appreciate that. Like, more and more people are listening every month, and we're getting great feedback. So we love that you all are listening and supporting us.
Yeah, and always hit us up if you think there's a movie you want us to check out and analyze. You want us to shrink wrap. And until such time, we will keep a seat on the movie couch for you. And hope you join us next time.
Okay, so long.